Oh, what's happening? Okay, I think it's recording. All right, folks. Let's give this a try. So, I'd like to deal today with the issue of regulatory agencies that govern our profession, right? First things first, question for you. Can anyone tell me the difference between these two words here? Rules versus regulations. Any thoughts?
Rules from government or
policy, and you have to follow the rules.
You have to follow the rules. If not, what happens?
You can get punished for that. Or,
You can?
yeah.
Okay, so let's see. Rules. You must wear uniform to class. One person. The rest, no uniform. Okay. Now, so what are my options? How shall I punish all of you? Not you.
Not coming to class.
Ah, okay. Who made this rule?
The teacher.
Okay, so I made the rule. So I can't really punish you too much. Well, unless you ask. But the fact of the matter is, I make the rules. What's the most I can do? Kick you out of class? Right?
Yeah.
I mean, that's basically what it boils down to. Now, regulations. The best way to define the word regulation would be laws. So regulations equals laws. Who makes laws? Okay. So laws equals government, abbreviation, GOVT. So we got regulations, which are laws. Laws are made by the government or government agencies, okay, which is basically government. So to make a long story short, government makes laws. Now, if laws are broken, you may be deprived. So if broken, you may be deprived of money, liberty, or life. I mean, it gets pretty severe out there. If laws are broken, you get punished, and they take away your money, your freedom, or your life. I mean, does that make sense? Sure it does. So we better stay away from breaking regulations and laws, right? Which are one and the same. Now, what are rules? Rules, well, rules are primarily guidelines, right? They are created by professional organizations. Who else? Employers. Violation of rules results in loss of membership. So you may be deprived of your membership to an organization. All right? Nobody wants that, but it's really not punishable by law. So there are various organizations and entities that govern our profession. Healthcare in general, or in reality, just about any industry. So we have regulations, which are laws put together by government, and we have rules that we follow, that we adhere to the standards of our profession. If we violate those things, we are booted out from our profession, but we don't go to jail, and we're not penalized financially. I mean, sometimes you could be, but not, like I said, pay this or go to jail. No, pay this and get your membership back. Over here, if you screw around with the laws, hey, you go to jail. Hey, you get a parking ticket, speeding ticket, and if you don't pay that, guess what? They don't renew your license to drive. Or, depending what you have done, they will put you in jail. Does that make sense? And also, you should understand that when you violate the laws, you violate the laws against society, not against one individual. It's against society. You may, walk down the street and feel the urge to punch somebody in the mouth. Okay? And you do that. And that person says, oh, no, I don't want to sue you. I deserved it, really. I shouldn't have looked at you funny. But the fact of the matter is, if you punch somebody in the mouth on the street, you actually committed a crime against society, not against that person. Because when you violate the laws and freedoms of one individual, you actually violate the laws and freedoms against the entire society. Okay, and that's why it's the state that sues you, right? So you may have heard cases, Commonwealth of Massachusetts versus Mr. Steve. All right? So, so it's the Commonwealth of Massachusetts that actually files the lawsuit, not the person whom you struck. That person has a right to sue you as well for damages, but it's the state that will actually put you away. Make sense? All right. So we don't mess around with these guys. We really don't want to mess around with these, but if you don't care about your membership, at some point in time you'll take the national certification boards, you'll pass them, you'll be a member in good standing, but you break the rules, they boot you out. Make sense? Okay? Let's talk about some of the government agencies. All right? Let me erase the board. It's always a pleasant trip. And again, remember what I keep telling you. Not everything that's in the book is on the test, but everything I put on the board is. And so, the biggest beast of them all, as far as we're concerned, well, there's two beasts that we're dealing with, and that would be, first one would be OSHA. I may have mentioned it before when we talked about bloodborne pathogens, did I not? Did I talk about that when I talked about the chain of infection? Well, I may have, but it doesn't matter. I'm going to mention them one more time. Okay. Also, I'd like to give you like a little bit of a warning. Okay, I don't really have to put this on the board, but every time you see words like agency, like Central Intelligence Agency, bureau, department, you know you're talking about government. Agency of what? And lately they introduced words like authority. Authority is neither there nor there. They have some government roles and some private enterprise roles, and they don't know how and what they're governed by. But anytime you see agency, bureau, department, section, all these words mean you're dealing with government, state or federal. Makes no difference. Okay? Ready? First government agency, OSHA. Occupational Safety and Health Administration. Administration, right? Government. Occupational Safety and Health Administration. The thing to remember about OSHA. OSHA, as the name suggests, it's occupational. If we talk about occupation, we're talking about employee. So OSHA, employee safety. Employee safety. Please memorialize it for yourself. Because if they do ask you a question about OSHA, it'll be this. Don't let these questions fool you at times. OSHA is always about employee safety. Thing to remember about OSHA as far as we're concerned. OSHA, the biggest thing that they created for the healthcare industry is the Bloodborne Pathogen Standard. Okay, so let's look at the words bloodborne and pathogen because you do need to know their meanings. First and foremost, the word bloodborne is made up of two word parts, blood and borne. Blood actually includes blood and body fluids. By the way, things like feces, poop, is also considered to be a fluid because it's moist. Okay, so anything that contains moisture in the body is considered to be a fluid. Born, it's not like giving birth or somebody is born. B-O-R-N-E means carried. Like airborne troops, paratroopers. The word pathogen. Patho means disease. Gen means causing. And of course the word standard. Does anyone know the meaning of the word standard? Sure you do. Ever been to a parade? Ever see? Have you ever seen a person who's called a standard bearer in the parade? Standard bearer is a person that carries the flag. The word standard actually means flag. So what's a flag? Flag is something that represents something for which you stand for. Right? Up till now, American flag was life, liberty, pursuit of happiness, right? Something like that. So standard. Look at the root of the word stand. Something you stand on. Okay? Or something you stand for. Alright? So the best example of a standard, right outside, no parking sign. Speed limit sign, right? Speed limit sign is better, right? It says 35 miles per hour. That means if you go 40 miles per hour, you're 5 miles over the speed limit because this limit is posted. It's the standard. Something against which you measure yourself. Does that make sense? Now, from bloodborne pathogen standard evolved some things which are important to us. Things called standard precautions. I do not provide for you the book example or definition of standard precautions. You can look that up yourself. I will not give it. I give it my own way. And I want you to memorialize it. Okay? I may have mentioned it before. I'll mention it again and again and again and again. Standard precautions, first and foremost, represents a state of mind where you believe that all patients, all patient care equipment are contaminated and contagious and will kill you. I'll say it again and again. All patients, and that includes all their body fluids, that includes your aunts and uncles, grandpas and grandmas, makes no difference who that person is. All patients, all patient care equipment is contagious, contaminated and contagious, and will kill you. Why am I telling you in this uncertain, in this certain terms that something like that will kill you? Well, it's a known fact that not everything will kill you. Well, if you keep thinking that, you're not going to know what's going to kill you, what's not going to kill you. I mean, truth be told, the biggest killer in the world is the flu. Are you concerned about the flu? Oh, I've got the flu. The answer is no. I'm not concerned about that. It's either going to get better in 7 days or a week. One or the other. Right? It's going to get better. Not so is the case in the world. Biggest killer kills more people than anything else. The flu. It's nothing.
Now it's corona.
So, to make a long story short, you don't know who's got what, and you don't know what it's going to do to you. Yes, you do. It's going to kill you. Why am I telling you? Because you need to take precautions. Precautions include something called PPE. PPE. Or personal protective equipment. OSHA mandates that your employer provides you with a PPE. I didn't say give it to you for free. I said provides you with a PPE. And you know what else they say? They should give you a hepatitis B vaccination. It should be available to you. Okay? So they should provide PPE and they should provide a hepatitis B vaccination. That's what they want from the employer. That's on the test. Every test I've seen so far, every person I asked, these questions were there. Okay? So, line of logic, OSHA, Occupational Safety and Health Administration, okay, came up with bloodborne pathogen standard. Here's our definition. And from bloodborne pathogen standard came standard precautions, which dictate the use of personal protective equipment, which dictate the fact by mandate, by law, that the employer must provide you with a PPE, personal protective equipment, and a hepatitis B vaccination. Is that clear? Any questions about this? Shall we move on?
Yeah.
All right, let's talk about the next beast. All right. The next big one is something called the FDA. FDA, or the Food and Drug Administration. There's that telltale word, administration, which means government. So you may ask yourself a question. What was the Food and Drug Administration having to do with us? We have no food or drugs in our department, and in the vast majority of the department. I mean, who has the food in the hospital? The dietary? But what do they have to do with sterile processing? Well, the fact of the matter is that Food and Drug Administration, which has been around for a long time, the name should be changed, but it dictates and regulates anything and everything that comes in contact with the human body. I mean, right in a little room next door, we have the dental chair over there. Well, guess what? It's not just the dental chair, but the FDA regulates the type of material used to construct that dental chair, especially the material on which the patient sits. So if a patient is to have any kind of physical contact with the body, FDA regulates it. The X-ray machine that's hanging over there, this guy right over here, all these things, I mean the sterilizer, the X-ray machine, anything and everything that comes in contact with the patient, whether directly or indirectly, is regulated by the FDA. Okay? Does that make sense? Not only that, how do they regulate it? They regulate and they classify medical equipment. And you know what? They regulate it by classes. They assign classes to medical equipment. Class 1, Class 2, Class 3. Okay, each class has a value of dangerousness to the patient. So that's how the class is really assigned. If something is almost impossible to cause any harm to the patient, no matter what happens, like for example, the covering on the dental chair, what could possibly happen to the patient if he comes in contact with that particular device? Or with a blood pressure cuff. You've all had blood pressure taken, haven't you, before? Could anything truly harmful come to you from that medical device, like a blood pressure cuff? The answer is no. I mean, what is it? Some kind of a canvas or some other material that comes in contact with human skin? Well, the fact of the matter is that some allergens could be present on that or in that material or some dye, and you may get a minor skin rash. Does that present a major problem? No. Could that evolve into a major problem? No. Therefore, it's a Class 1 device. So, Class 1 device means virtually no chance of injury. Now, you may have already guessed that we're progressing from Class 1 to Class 3 to a degree of dangerousness. Okay? I'm going to skip Class 2 for a second, and I'm going to go to Class 3. And Class 3 is something that is certain to cause death or serious injury. Let me ask you a question. A sharp scalpel, what would you consider that to be?
3 plus 3.
Class 3. Okay, kind of makes sense, right? Very sharp scalpel, but no, it's not. So I could ask you the same question. Is a loaded gun that's lying down on the table dangerous? No. It's only dangerous if somebody holds it in their hand and points it at you. The same thing with the scalpel. The scalpel is only dangerous if it's in the surgeon's hands. Now, surgeon is the class 3 device. If a surgeon was to be classified by the FDA, certainly that would be a separate class. Class 4, really dangerous, a killer. Okay? In any case, you see how the logic works. If a device by itself that's just sitting there, minding its own business, is it dangerous? Now, counterweigh that with one second. Counterweigh that or oppose that to a tiny little valve that they use for heart surgery to replace valves in the heart. You know what it is? It's a little basket with a ball that goes up and down, up and down. It's not sharp, it's not anything. But if that little ball gets stuck in one position, just like that, the person's dead. So if that valve is already installed, if that valve is already inside the patient, and that's what its intended purpose is, to be inside the patient's heart, if that thing fails, it is certain to cause injury, serious injury, or death. Stroke, heart attack, death. Do you see what I'm saying? Now, I'm going to shock you even further by telling you what the class 2 device is. Now, a class 2 device is somewhere between this and this. It's between serious injury and death and between virtually no chance of injury. So if we have a device, for example, that under its normal operation may cause or lead to some injury, then we have an issue. Give you an example. Tabletop sterilizer, or every sterilizer that we have in the hospital, is a class 2 device. Packaging material for surgical instruments is a class 2 device. Why? Well, because if that thing fails to work properly, then the device that you sterilized is unsterile, and that will lead to injury. You understand? Does that make sense? Packaging material, the same thing. If the packaging material fails to provide an adequate barrier against infection, it'll expose the instrument within, and it will lead to injury. Not really death. That would be like a remote possibility, very remote, but its actions will lead to a problem. Because of this classification, the FDA instituted special procedures that every company that wants to manufacture medical devices that come in contact with the patient have to go through a certification process. And this certification process is called 510K certification. And the 510K certification is designed to make sure that every manufacturer of medical devices certifies and undergoes extensive testing that will fit into this classification of instruments, okay? And it works properly. The X-ray machines, the sterilizers, all have to get 510K number. So today, if I wanted to buy, for example, a dental X-ray machine, it would cost me, I don't know, between $3,000 and $5,000. Or I can go online and buy one from China for $500. Okay, well, the one from China may do the same thing for a little while, but we don't know how much radiation it emits outside of its case. So the fact of the matter is the FDA didn't go through the testing, didn't issue 510K certification, and the person who's taking the X-rays, or the person sitting in the chair that constantly gets exposed over and over to extra, scatter radiation from the machine, is getting exposed. So there's your reason for having, these certifications. Do they work all the time? No. Are there issues with it? Sure. But it's better than nothing. Okay? So, having said that, the FDA also has a system in place to get these devices off the shelves or out of the hands of the doctors if they find something wrong with it. So, they also classify that, okay, and also by numbers 1, 2, and 3, except vice versa. So, class 1 recall. So, recall classifications is also 1, 2, and 3, except this time it's by priority. Priority number 1, we go after class 3 devices, the ones that are liable to kill. Number 2 goes with number 2, and number 3 goes with number 1. Does that make sense? Right? So, I don't know, if you've been watching the news, they said Kraft Foods is recalling some cottage cheese. So all the cottage cheese that they sold has to get packaged or brought back to the store for a full refund, and the store will send it back to Kraft Foods. They screwed up, something went into the cheese, or people already ate it, nothing bad happened, they just went to the bathroom one extra time, or two. Alright, and so they recalled it. But you know what, back in the day when there was a scare with Tylenol, many, many years ago already in America, somebody was putting, poisonous pills inside Tylenol. They yanked Tylenol off the shelves like nobody's business, just like this. Overnight, the Tylenol was gone. And, you may look at all these boxes or little bottles with pills nowadays. They come with super sealing caps and extra glue on top. It all happened after 1981 when the Tylenol, when there was a killer, I think in Chicago, was spiking all the Tylenol with poison and people were dying. So now they introduced the tamper-resistant bottles for this, specifically, also for drinks too. All these drinks that come and it makes a popping sound when you open it up. That's because of that poisoning scare. Make sense? Does this make sense? Okay, good. I'm not gonna, burden you too much more with the FDA. This is cool. Some of the stuff you have to leave for yourself for your own pleasant reading of the chapter. But there isn't really that much more that you need to know. Make sense? Any questions? All right. Next one. We have a couple. They're not quite as important to us, for the purpose of the examination. They're just going to be very generic questions. They are the EPA, and believe it or not, the DOT. EPA is the Environmental Protection Agency. Believe it or, you can believe it for sure that they have their dirty little fingers in our business. They do. I mean, for good reason. We do deal with all sorts of toxic chemicals that we use. All right, and when we're going to be talking about, disinfectants, you'll know all about it. In the meantime, believe me when I tell you, we have some toxic stuff that we deal with. And guess what? When we're done using it, where do you think we put it? Down the drain. Remember, that goes in the water you drink. We don't get it from the streams and from the rivers and reservoirs. We get it recycled. Every time you flush, you fill your glass with that stuff. In any case, moving right along. So the Environmental Protection Agency regulates what you may or may not do to dispose of your used and spent disinfectants and sterilants and other stuff that you use in the department. Does that make sense? Do I need to bother writing that down? Is that clear? Okay. The DOT, the Department of Transportation. There's a funny one. How does the Department of Transportation have to do with us? I mean, what? Well, a couple of things. I mean, we have lots and lots of these things in the hospital. This is a hazardous medical waste container, also known as Sharps containers. Biohazard infectious waste, says so right there. That would be a good little symbol for you to remember. That's a biohazard right there. I'll bring it a little bit closer to you so you can see it, all right? Orange sign with black marking says biohazard on it. Okay, box is usually orange or red. Well, this is filled with biohazardous material. Okay, so what? Well, guess what? Let's say you have a big box of it filled, and your boss tells you, hey, Steve, do me a favor. Put this in your car and drive it to our campus. We have an inspection, different campus. Put it in your car and just drive it off to the other place. We said, yes, ma'am, yes, sir. You take this box, you stick it in your car, and off you go. It's just down the street. But guess what? On the way to that other campus, while transporting this stuff in your car, you get into a car accident. This big box of stuff just flies out the window. All these things pop open, and all these syringes and blood soaked and guts and everything else comes out of these boxes and gets strewn all over the street. You're not going to come out there with a little whisk broom and a little pooper scooper to try to get that cleaned up. Let me tell you what's going to happen. The fire department and the police are going to seal off 1 square mile radius around what happened. All the people stuck in traffic will wish to kill you. They're going to have people show up with, you know, space suits and so on and so forth, you know, like sounding like Darth Vader. Moving very slowly with their brooms and space age equipment. They're going to scoop everything up. Then they're going to spread some kind of a chemical that's going to soak up everything from the pavement. Street is going to be closed for a full day. Everyone and their uncle with blinking lights are going to be there. You will go to prison. You will be charged. You will owe a lot of money to the hazmat team, hazardous materials and disposal team from the fire department, to have come in with their brooms to sweep that up and spread the stuff around. I'm talking about tens of thousands of dollars. You'll go on a show trial, they're going to show you on TV. Folks, having said all this, please do not take anything that doesn't belong to you. Every time these boxes are moved, every time you sneeze with these boxes, you have to have a routing sheet that shows you where the darn thing went, who took it, and where it's going. And when it gets there, the other people put a stamps on that form, so everyone knows. And for the next 7 years, maybe longer in some cases, you need to be able to say where these things went. They're transported on special trucks with all sorts of permits on them, at only specific times of the day, because some of the stuff does not go during the normal business hours. It goes either at night or very early in the morning. Okay? And sometimes you may see state police pull over a truck like this with all sorts of, square signs on them, or rhomboid signs that show what they're licensed to carry. And they're going to inspect them, and they're going to ask them, hey, what time is it? What are you doing on my road at this hour? You got something hazardous in the back? Oh, no, sir, I don't. Or if you do, guess what? Big trouble. You understand why the DOT is involved? If you're transporting hazardous or toxic gases or things that we use for sterilization, like ethylene oxide and other chemicals, they too are regulated by the DOT. Okay, and again, that makes our stuff. That's why you wonder, why is it that this stuff costs so much money? Well, this is one of the reasons. The EPA, the FDA, the DOT, and OSHA. I mean, all these things are necessary. Is there overkill built in? Yeah. But you know what? It is what it is. It's better than finding, like we did in the olden days, where people used to take hazardous medical waste and just bury it at the beach in Quincy. If you remember some years back, about 20 years ago, somebody did find all these things just buried there in Quincy. Somebody didn't want to pay because it costs about $60 to dispose of one of these little buckets over there. It's not cheap. Not cheap. Alright, does this make sense? Okay. Kill this.